You just know that you have to draw diagrams on Preeti's hand.
We don't know anything. Kind of we can expect that. So आपने बहुत सी वीडियो देखी होगी regarding mental health in MBBS, how toxic MBBS is and even the suicides in MBBS. So आज हम उसकी ground reality check करने वाले हैं कि क्यों एक इतना बड़ा इशू है और क्या एक्चुअली एक इशू है, इफ़ yes क्या प्रॉब्लम है, इवन क्या सोल्यूशन है, हाउ टू सीक फॉर द हेल्प. सो ये पॉडकास्ट ज़रूर रहने वाला है MBBS स्टूडेंट्स के लिए, इवन आई थिंक नीट यूजी एंड PG एस्पिरेंट्स के लिए. और आई थिंक द JRSN एट द ईच स्टेप, बिकॉज इन द मेडिकल सिस्टम देयर इज अ कंप्लीट हायरार्की एंड टॉक्सिसिटी इज देयर द ईच स्टेप. और इवन हर को जो अपनी लाइफ में स्ट्रगलिंग फेस है, दिस पॉडकास्ट विल बी वेरी इंपॉर्टेंट फॉर दिस. सो एट एन एंड वी ऑल्सो हैव ए Q&A राउंड, जिसमें कि आपने जो क्वेश्चन पूछे थे मुझे इंस्टाग्राम हैंडल पे, वो क्वेश्चन मैं सर से पूछने वाला हूँ एंड आई विल डिस्कस द आइडिया बिहाइंड शूटिंग दिस पॉडकास्ट. ओके, सो लेट्स स्टार्ट. सो फाइनली काफ़ी रेटे के बाद, हाय सर.
Hello, hi.
So today we have Aditya sir with us. So he is currently psychiatrist and an assistant professor in my college only, that is GMC SIDDIPET. I know sir, मैं थोड़ा सा anxious हूँ.
It's all right.
Okay sir, how are you?
I'm great, as usual.
How is your mental health sir?
That's an interesting question. My mental health is काफ़ी ठीक है. It fluctuates, but it's good. Overall, it's good. So how is your mental health?
पॉडकास्ट के रिगार्डिंग काफ़ी फर्स्ट है तो काफ़ी थोड़ा सा एंशियस है, बट ओवरऑल इट्स ओके. लाइक सर हमारे साथ काफ़ी चिल है, इसलिए मैं भी काफ़ी चिल हूँ. तो पॉडकास्ट में शायद इफ़ मैं किसी चीज़ से डिसएग्री कर लूँ या फिर कोई चीज़ को काउंटर कर लूँ तो इसका इफेक्ट मेरी अटेंडेंस पे नहीं पड़ेगा, क्योंकि करंटली मेरी साइकेट्री की पोस्टिंग चल रही है.
देख लेंगे.
सो वी स्टार्ट लाइक सर, व्हाट इज मेंटल हेल्थ? लाइक वी आर प्रोफेशनल, लाइक वी नो दैट देयर इज अ टेक्निकल टर्म दैट आउट ऑफ दिस, इफ दिस इज बैड, दिस इज अ मेंटल हेल्थ एरर. फॉर अ नॉर्मल पर्सन और फॉर ईच एंड एवरी, लाइक व्हाट इज मेंटल हेल्थ? लाइक क्या वो देखेंगे कि लाइक उनके लिए मेंटल हेल्थ क्या है और कैसे वो खुद की मेंटल हेल्थ को देख सकते हैं कि लाइक आई एम मेंटली इल और नॉट इल और स्ट्रेस, और लाइक एनी कट ऑफ लाइन जिससे वो लगा सके कि लाइक पता लगा सके कि हम मेंटली इल है या फिर क्या स्टेटस ऑफ माइंड है हमारा.
या दैट्स अ ग्रेट क्वेश्चन. मेंटल हेल्थ में ज़्यादा आई एम नॉट गोइंग टू गिव मच ज्ञान ऑन दिस, लाइक नॉट टेक्निकल नॉलेज ऑन दिस. अगेन क्लासेस में तो आई एम ऑलरेडी गिविंग यू ऑल दैट. सो simply put, mental health is something like your emotional, social and psychological well-being. So emotions like feelings, psychological is your thoughts and social are your behaviors or your interactions with people. तो ये 3 domains होते हैं कि emotional, social and psychological. These 3 if they are intact and they're well, that means you are having a better or good
like if ये 3 चीज़ें on track है तो like we are more or less mentally fit.
Right.
Okay. सो लाइक एक चीज़ जो बीइंग स्टूडेंट मेरे को लगती है कि इफ़ यू आर डूइंग MBBS, आई थिंक स्ट्रेस इज अ पार्ट ऑफ MBBS.
ऑफ कोर्स,
लाइक इट इज़ अ पार्ट. यू विल बी लाइक यू सी दैट यू आर चिल बट यू कांट बी चिल, यू नीड टू टेक द स्ट्रेस.
यस.
सो लाइक जैसे जनरल चीज़ है कि एग्जाम है तो स्ट्रेस तो है, एग्जाम कम विद स्ट्रेस. और वो स्ट्रेस लाइक कैसे मैं कहूँ कि ये स्ट्रेस लाइक मेरे लिए प्रोडक्टिविटी, बिकॉज आई थिंक एक मिनिमम लेवल ऑफ स्ट्रेस तो एक प्रोडक्टिविटी के लिए जरूरी है.
राइट.
बट इफ़ वो अबव एक कट ऑफ हो जाता है तो फिर वो शायद तुम्हारी परफॉर्मेंस को भी डाउन कर ले. तो मैं इफ़ मेरा पर्सनल एग्जाम्पल लूँगा, कब मैं सोचूँ कि अभी ये स्ट्रेस है दैट इज़ ओके, और कब ये इतना ज़्यादा हो गया अब शायद ये लाइक मेरे को किसी की हेल्प की ज़रूरत है, तो वो मैं कैसे लाइक कट ऑफ लाइन क्या, मैं मेरा कैसे ध्यान रखूँ, लाइक व्हाट इज द कट ऑफ लाइन?
कट ऑफ लाइन देखो, देयर इज नो हार्ड एंड फास्ट कट ऑफ लाइन एज सच कि इतना लेवल स्ट्रेस है तो इट इज़ टॉक्सिक और इज़ नॉट गुड फॉर यू. सो एज यू मैंशन राइटली, a little bit or a minimum or optimal level of stress is important for better performance. Like stress और performance का relation ऐसा होता है कि एक bell curve के जैसा होता है. जितना stress बढ़ता रहता है उतना efficiency और performance बढ़ता है, लेकिन एक peak आ जाता है जिसके बाद अगर stress ज़्यादा बढ़ेगा तो वो peak नीचे गिर जाएगा.
Okay.
So what is an optimal level of stress? That will vary from individual to individual. तुम्हारा एक ऑप्टिमल लेवल रहेगा, मेरा एक ऑप्टिमल लेवल रहेगा, बिकॉज दैट डिपेंड्स ऑन द पर्सनैलिटी. हम क्या सेंसिटिव पर्सन है, हम स्ट्रॉन्ग पर्सन है, हमारा चाइल्डहुड का एक्सपीरियंस कैसे है, हमारा एकेडमिक परफॉर्मेंस कैसे रहा, हमारा सेल्फ एस्टीम और कॉन्फिडेंस कैसे रहा. ऑल दीज फैक्टर्स दे इम्पैक्ट योर हाउ मच you're able to take the stress.
It's like the each and every individual का threshold है वो vary करता है.
It can vary. Yeah, it can vary. Just like your heartbeat. So not everybody's heartbeat is the same, right? Normal heart rate तुम्हारा क्या 100 रहेगा, मेरा शायद 80 रहेगा, 80 रहेगा. तो we can't say like you have a faster heartbeat or I have a slower heartbeat, right? It's all normalized for each individual.
Yes, I totally agree, because I think like for me, if I take my example, लाइक मैं अकेडमिक का इतना स्ट्रेस नहीं लेता हूँ, ऐसा नहीं मैं परफॉर्म नहीं करता, ओके आई परफॉर्म, बट मैं इतना स्ट्रेस नहीं लेता हूँ. एंड इवन आई थिंक आई सी ए स्टूडेंट लाइक इन अ लाइब्रेरी, एक स्टूडेंट का कल अगले दिन एनाटॉमी एग्जाम था, लाइक शी जस्ट गॉट अ सिनकोप अटैक काइंड ऑफ. सो इट मे बी लाइक उसके लिए वो थ्रेशोल्ड काफ़ी लो है शायद, मे बी उसके लिए एनाटॉमी एग्जाम का जो लाइक कल एनाटॉमी एग्जाम है, इट मे बी दैट शी इज द टॉपर. ओके, एक चीज़ अपन ये कह सकते हैं, अगर उसने अच्छे से पढ़ाई नहीं की है तो काइंड ऑफ स्ट्रेस इज लॉजिकल, बिकॉज if you don't study well you will get a low marks that will lead to your parents and teachers and all the stuff. So तब तुम्हें लग सकता है कि थोड़ा सा स्ट्रेस होना चाहिए, बट इफ़ यू आर अ टॉपर, इफ़ यू आर नॉट अ टॉपर, इफ़ यू आर गुड इन स्टडीज़ और इसके बावजूद आपको सिर्फ एग्जाम्स का स्ट्रेस हो रहा है, दैट विल बी काइंड ऑफ रेड फ्लैग, लाइक दैट शुड नॉट बी देयर,
राइट,
लाइक अबव अ पॉइंट.
राइट. तो फॉर व्हाट एग्जाम्पल यू टोल्ड, ये बात टॉपर की है और लाइक समबडी हु स्टडीज वेल, इट्स नॉट अबाउट दैट. Like you should know why you're studying. It's not because you want to satisfy your parents or your teachers or your friends, or you want to show that you are good at studies. See, anybody should study for their personal growth of personal knowledge. Okay. So अगर तुम किसी और के लिए पढ़ रहे हो और you're doing that any task for somebody else or something else apart from yourself, then your stress will be very dangerous for you, or it will start affecting you in a more bad way. So for the example which you gave, if she might be a topper, if she might be good in studies, okay, if she enjoys studying then that's fine, but if she thinks that मुझे class first का position maintain करना चाहिए, वो अलग लेवल की स्ट्रेस हो जाता है ना. सी
पॉइंट्स,
तुम मार्क्स के लिए मत पढ़ो, तुम अपने ज्ञान के लिए और नॉलेज के लिए पढ़ो. आई नो दिस माइट साउंड वेरी क्लीशे, बट स्टिल आई थिंक दैट वर्क्स फॉर एवरीबडी, बिकॉज I always follow one funda, bro. Like it's like nobody is gonna ask you how much score you're getting in MBBS after you graduate out of school, out of medical school.
By the way, how much you score in 10th, sir?
In 10th,
like sir, he is a psychiatrist and our assistant professor. So let's ask, like sir ने कितना score किया था in 10th and in 12th?
I think I have short-term memory loss. I don't remember much in my 10th.
But still, like
okay,
across idea.
Honest, I'm just kidding. Like I scored around, I did from ICSE, I mean ICSE board, and I scored around 75% शायद. Yeah, I'm not a topper.
तो सर जिसके पेरेंट्स को ये लगता होगा कि शायद हमारे बच्चे ने 90 से अबव क्रॉस नहीं किया, शायद वो इस फील्ड के लायक नहीं है, वो इतना इंटेलिजेंट नहीं है, कोई डॉक्टर नहीं बन सकता. नथिंग लाइक दैट.
Nothing like that.
75% दी वन एंड ओनली डॉक्टर आदित्य सर विद अस. सो ऐसा कुछ भी नहीं है कि आप लाइक 10 पॉइंटर्स हो या फिर अबाउट 9.5 CGPA तो ही आप इस फील्ड के एलिजिबल, ऐसा कुछ भी नहीं.
The thing is ना, the whole dynamics change after your 12th standard. Once you enter medical school या medical college या be it any other course for example, ये marking का dynamics है ना, पूरा concept ही change होता है. Like you might be in your 12th grade you might be a topper with 9.5 score, 95%, 96%. तुम्हारा फर्स्ट इंटरनल आ जाएगा MBBS फर्स्ट ईयर में, एनाटॉमी फेल भी हो गए तू, लाइक यू विल बी फेलिंग इन एनाटॉमी, मोस्ट ऑफ देम, एटलीस्ट आई फेल्ड इन एनाटॉमी.
यू फेल इन एनाटॉमी?
यस, द फर्स्ट इंटरनल, नॉट द फाइनल एग्जाम दो. तो इट विल बी ए शॉक टू अस, इट विल बी ए शॉक टू अस. अरे बाप, मैं तो 12th तक आई वाज लाइक द टॉपर, मेरा स्टेट में तो मेरा टॉप रैंक है, इसलिए तो गवर्नमेंट कॉलेज में प्लेस हुआ मैंने. हाँ, देन अगेन यू गेट ए ऑल टुगेदर ए शॉक व्हेन यू कम टू मेडिकल स्कूल एट साले सब लोग इंटेलिजेंट है मेरे साथ. तो ऑफ कोर्स द स्टैंडर्ड्स, द स्टेक्स आर हाई नाउ, यू हैव टू प्रिपेयर अ लॉट, यू हैव टू. सो हियर इट्स मोर लाइक यू लर्न, यू गेन सम नॉलेज, मार्क्स तो आ जाएंगे.
Okay.
Yeah, if you study for marks, that stress is a different level of stress.
और इवन इतना स्ट्रेस हो जाए कि शायद मार्क्स भी ना आए.
Exactly.
True. लाइक ट्रू एट एन एंड आपकी मेंटल हेल्थ हैम्पर होगी.
Yes.
ना तो आपके मार्क्स आ रहे हैं.
Yes.
तो आपकी जो 2 ऑब्जेक्टिव थे वही कंप्लीट नहीं हो रहे, तो फिर एट एन एंड कोई वर्थ है नहीं.
Because both have an reciprocal role, like mental health or academic performance. अगर एक if one thing is getting affected, obviously your mental health will get affected. अगर mental health affected है तो academic performance भी affect हो जाएगा. So both have a reciprocal role.
आप ओनली एनाटॉमी में फेल हो या फिर और भी सब्जेक्ट्स हैं सर?
मैं इंटरनल्स के बारे में बात करूँ, वैसे तो मेरा पूरा प्रोफेशनल एग्जाम्स तो एक सेट में क्लियर हो गए.
ओके ग्रेट. नहीं इंटरनल्स में तो सर हमारे भी हालत कुछ, बट ओके सर. एक चीज़ मेरे को लगती है कि जैसे बीइंग अ मेडिकल स्टूडेंट, लाइक वी आर टॉकिंग अबाउट मोस्टली अबाउट मेडिकल स्टूडेंट्स, लाइक मोर और लेस वी नो दैट वी आर मेंटली इल. लाइक इफ़ यर एग्जाम्स है, बट ओके मैं एक कंडीशन मान के चलता हूँ, जैसे मेरे को क्लिक हो गया लाइक आई एम नॉट मेंटली फिट, लाइक स्ट्रेस है बट वो इतना ज़्यादा है कि आई थिंक इट इज़ अबाउट थ्रेशोल्ड, इट इज डिक्रीजिंग माई परफॉर्मेंस, और लाइक आई गेट टू नो दैट इट इज़ हार्म फॉर मी. बट ओके जस्ट टेक एग्जाम्पल ऑफ माई सेल्फ. मेरे को जब पता चल गया है कि मेरी मेंटली हेल्थ ख़राब है, बट आई थिंक मेरे लिए भी बीइंग अ मेडिकल स्टूडेंट भी मेंटल हेल्थ के लिए किसी से हेल्प लेना बहुत मुश्किल है. तो एक नॉन मेडिकल से ओके सिंपल एग्जांपल जैसे मेरी साइकेट्री की पोस्टिंग हो रही है, शायद मेरे को आपसे ही मीटिंग करनी है, बट आई विल थिंक लाइक माई बैचमेट विल बी देयर. मेरे जो बैचमेट है वो वही उसी पोस्टिंग में होंगे, वो क्या सोचेंगे मेरे बारे में, और एक लेबल लग जाएगा कि दलपत हैज समथिंग दैट समथिंग लाइक लेवल काइंड ऑफ साइकेट्रिक प्रॉब्लम. इवन दे आर डूइंग MBBS, राइट. सो इवन प्रोफेशन में होने के बावजूद इतना स्टिग्मा है, लाइक स्टिल इट इज देयर, राइट. सो फॉर नॉन मेडिकल इट इज मच मोर डिफिकल्ट टू बी एक्सप्रेस देमसेल्फ लाइक ओके आई हैव अ इशू, कैन आई हैव अ सॉल्यूशन. So like for a normal non-medical, okay, for a medical, how to seek help, like how to be open to your problems?
That is a very important thing which you focused over here. I think the whole crux of this podcast should be this, ki how to identify whether you're having a problem and how to approach for help. So coming to the questions which you asked, there are a set of questions which needs to be answered in whatever you asked. So how do we know we are ill or mentally ill? Like see, there's nothing called like mental fitness. कोई कुछ नहीं है कि it's not like some physical fitness कि whether you're fit or not. Your mental health, as I answered you, mental health is fluctuant. It is okay to be low. It is okay to be happy. It is okay to be sad. It is okay to be angry.
Okay, mental is not like 24/7. I'm super heavy. It is not at all like that.
No, you ask anybody, even the most happiest. You can ask Ambani also. If he says like, "How is your mental health? You're so rich. You got everything. Like one snap, you can get anything."
जो चाहिए ला सकता है.
Exactly. So are you happy? Like he might be happy most of the time, but there will be days when he is sad. This is my subjective opinion. He might not be sad, but. Like see, what I want to convey is that your mental health is like waves of water. Like ocean में जैसे waves आते हैं ना, like it is fluctuant. Like it can be high, it can be low, it can be normal for a period of time and all that. So first you have to acknowledge and accept that it is okay to face all emotions in our life. We need not be happy always all the time. You can be happy, you can be sad, you can be angry, you can be frustrated, you can be irritated, you can be crying. Okay, all these are normal. Second thing, when am I mentally ill? So, like as I told you, all these emotions are normal. Like I'm a psychiatrist. Just because I preach that everybody should be having positive mental health, that doesn't mean I don't have my negative emotions. I do have my negative emotions. But do I have a problem? That is when I have to ask myself, is this negative emotions affecting my daily life? कि मेरा दिन भर जो काम है, मेरा रिलेशनशिप्स है दूसरों के साथ, या मेरा साइकोलॉजिकल स्टेट अगर मेरे वर्क को, ऑक्यूपेशन को या पर्सनल लाइफ को अफेक्ट कर रहा है ऑन ए प्रिटी लॉन्ग टर्म बेसिस. लाइक एक दिन अगर टुडे आई एम वेरी फ्रस्ट्रेटेड, लाइक आई माइट गो होम एंड शाउट ऑन द पीपल अराउंड मी, और आई माइट नॉट अटेंड वर्क, और अगर गए तो भी आई माइट नॉट डू परफेक्टली. इट्स ओके टू बी हैविंग बैड डेज एट वर्क और एट होम, बट if that is continuing for a certain period and you feel वो एक pattern बन रहा है, that is when you should have a doubt कि you might have mental illness. Then also you should not label yourself or think that कुछ तो गड़बड़, like that I might be having something. That work you can leave it on us.
Because I think because आज के टाइम पे एक बहुत सा थोड़ा सा cool tag भी है, like I'm not mentally fit. But the thing is, if आपका एक डे खराब गया है, आपका एक दिन खराब गया, तो it doesn't mean that you are mentally not fit.
Right.
Because being sad is not like you can be sad in a mentally fit person. The mentally fit person also can be sad.
Exactly. Because sad is one of the 7 emotions or 6 basic emotions we have. Sadness. So it is okay to be sad. See, अगर तू एग्जाम में फेल हुआ ना तो तुम्हारा ब्रेकअप हुआ, how can you expect you to be too happy?
Yes, common sense.
Yeah. तो okay, let's not talk about any stressors. It is okay to be sad without any reason. You might be hearing some Arjit Singh के गाने. Suddenly you feel कि even if you don't have a girlfriend, you feel like काश अगर मेरा girlfriend से breakup होता तो तुम भी उदास हो जाते हो.
Double vibe ले सकता था.
Exactly. See, your sadness, your emotions all depend upon the environment you are and the emotional state you are. So it is okay to have all these emotions. So as I told you, you can then suspect that you might be having some issue, then that is the time you can go for some professional help. The problem what people do is, as you told, it has become a fancy term these days कि लोग बोलते हैं कि मैं depressed हूँ, नहीं तो मुझे बहुत trauma है. This trauma is a very fashionable word these days. No offense to people who have actual trauma, but the trauma word is being very misused these days according to me. Trauma एक बड़ा event है जो really impact हुआ है तुम्हारी life में, but these days एक बात जो बोली दोस्त ने अगर गुस्से में तो वो ट्रॉमेटिक हो जाता है, बाप ने कुछ बोला तो ट्रॉमेटिक हो जाता है, People are misusing words, I feel. I think those words should be reserved for something very specific. So instead of Googling for things, even we medicos do that.
Yes,
that is
sir,
one
actually.
wrong thing. We are in the field, yet instead of seeking help from a professional who's just across the postings or in the same hospital building, we often tend to search for symptoms and then we come to diagnose कि हाँ मैं depressed हूँ या मुझे anxiety है.
सर हमारी बातें कर रहे हैं.
Yeah. So they say I have palpitation, sir. I might have some cardiac issue. Today echo करवाते हैं. So because of half knowledge is dangerous, they say, na?
Yes,
so
sir.
that's the thing with medical students, and medical students have often this syndrome known as illness anxiety. Because we read a lot of pathology, na?
और लगता है सारी
So
चीज़ मेरे को ही है.
we relate to ourselves.
Okay.
So it is very common. I'm not saying I am very unique. Even I faced this syndrome when I was in my training.
Okay.
जब तुम साइकेट्री पीजी कर रहे हो तो तब भी तुझे लगे कि अरे ये तो सब मैं तो डिप्रेस्ड ही पूरा लाइफ में तो डिप्रेस्ड ही हूँ. But it's not that. With experience and with first you understand the nuances of it, then you will understand कि what exactly is depression, what exactly is being normal. तो instead of googling, you should reach out for help. और बात आ गई है स्टिग्मा की. As you told, you are in my posting. अगर तुझे कुछ इशू है, तुझे मुझसे बात करना है, तो of course it is very normal for you to feel कि अरे मेरे फ्रेंड्स सारे सब है इधर. तो अगर फ्रेंड्स नहीं है तो भी इवन इफ यू आर इन अदर पोस्टिंग यू माइट फील कि अदर पोस्टिंग पीपल विल बी देयर, लाइक दे माइट सी माय सीनियर्स माइट सी
someone who knows me.
Exactly, because you are in the same campus.
Yes, sir.
So it becomes difficult. So what are the ways? You can reach out by talking to them over phone or scheduling a private appointment. और वो सब नहीं हो रहा है तो एटलीस्ट यू कैन रीच आउट फॉर योर क्लोज फ्रेंड एंड डिस्कस अबाउट दैट, whom you actually believe or trust them, and you can start discussing about that. And then maybe you can arrange for some appointment with some faculty or some clinician, whosoever is needed at that point of time. Because as medical students, I'm not encouraging that stigma part. Actually, any party or any person should be able to walk in without any fear of judgment to a psychiatry OPD.
But like instead of not seeking for the help, you can try with some like going personal, taking a personal appointment. You
Yes,
can try with that.
yes.
Instead of not taking
Yes,
help,
you can do
taking
that.
help is much more important.
Yes, you can. Taking help is more important. But and one more thing I want to tell is, as the future medicos who are actually going to take the torch bearers of the next generation medicos, you should break the stigma. Like you should normalize visiting the
Yes,
mental
sir.
health professional.
Like if
Like अगर पोस्टिंग में है 10 बच्चे है पोस्टिंग में, फिर भी अगर आपको कुछ प्रॉब्लम है तो आप कॉन्फिडेंस से या एटलीस्ट यू शुड बी एबल टू आस्क आउट कि सर मुझे आपसे कुछ बात करना है,
yes,
पोस्टिंग के बाद मिल सकते हो क्या. दैट एटलीस्ट दोज वर्ड्स यू शुड बी कॉन्फिडेंटली एबल टू से इन फ्रंट ऑफ योर फ्रेंड्स ऑल्सो. देयर इज नथिंग रॉन्ग. अगर तुझे फीवर है, तू जनरल मेडिसिन पोस्टिंग में है, will you be fearing to speak out that?
Not at all.
अगर फीवर नहीं है तो भी बोलते सर मुझे फीवर है प्लीज गिव मी ऑफ बोल के. या तो when it comes to mental issues, people have this prejudice or that stigma towards it कि लोग क्या सोचेंगे और समथिंग, यू नो. लोग का छोड़ दो, एटलीस्ट मेरे पोस्टिंग्स मेरे बैच में क्या सोचेंगे, बिकॉज वी ग्रो अप विद देम. हाँ, अरे बाकी टाइम में तो सब कुछ आई एम लाफिंग एंड स्माइलिंग. नाउ दे आर सीइंग माई दिस साइड ऑफ इट. दे माइट थिंक ऑफ मी एज कुछ यू नो समथिंग एल्स. दे माइट नॉट befriend मी और दे माइट टॉक समथिंग एल्स अबाउट मी. होता है, अक्सर होता है, बिकॉज many people have experienced that. Because people have experienced, that is why people have such opinions. We should start breaking that cycle.
Okay, and I think being a medico, we also represent society.
Right.
Like if being a medico, I can't do this, how can we expect a non-medico?
True.
Like first I need to open myself that okay, I'm a medico, I can have a problem, I can be medically unfit, so I need to take the help.
Right, you should be able to take help. Like it is hard, definitely it is hard, because opening up your vulnerable side to somebody, be it in faculty or anybody or any doctor for that instance, mental health professional, it is definitely hard, but it is required. Like you should take that step for your betterness or betterment.
Still I think कि चीज़ें क्यों मुश्किल है. Like मैं आपके सामने आया, मैं सोचा ठीक है मोटिवेट हूँ, मैं आई नो दैट वी आर रिप्रेजेंटिंग सोसाइटी, वी आर गुड, वी शुड डू दिस एंड ऑल. बट आई थिंक शाम में सब दोस्त मिले एंड दे स्टार्ट लाइक अच्छा आज गया था क्या हुआ. सो आई एम लाइक मेरे को डर उस चीज़ से है, नॉट मी पर्सनली, आई एम रिप्रेजेंटिंग समवन. लाइक चीज़ उस डर से है कि और वो चीज़ होनी है. तो मैं या फिर तो मैं ये समझ लूँ कि उनके उस कहने से मेरे को फ़र्क नहीं पड़े, क्यों वो लोग तो कहेंगे. लाइक इट विल बी देयर. माई फ्रेंड विल बी लाइक, इफ मैं आज ओपीडी गया हूँ, वो फ्रेंड शाम को बोलेंगे और बता लाइक ओके आउट ऑफ 10 फ्रेंड्स 1 फ्रेंड विल लाइक ओके क्या हुआ है, मेरे को बता क्या हुआ है, लेट डिस्कस, लेट सॉर्ट इट आउट. 1 फ्रेंड में भी देर. बट आउट ऑफ 10 9 विल बी लाइक ओके भाई क्या हो गया, क्या सीन चल रहा है तेरा, ये दे विल बी लाइक काइंड ऑफ मेकिंग फन ऑफ इट. सो आइदर आई शुड नॉट talk about this in front of them, or either I should face whatever they are saying after that. So what should I do? Because they will tell, I know that they will tell.
Okay. Very interesting situation. Considering it might be hypothetical or it might be real life inspiration.
Okay.
Fine. So as humans we are very curious individuals. We are very curious what is happening in other people's lives. That is very much
Actually.
Isn't it true? Yes. क्या दूसरे like if your friend is not being seen for 10 minutes तो पूछेगा भाई किधर था, क्या चल रहा है, क्या कर रहा है. तो and of course when you extrapolate it into a hospital setting and especially you're going to a mental health professional, तो obviously लोग पूछेंगे ना, especially the people who you know you थोड़ा बहुत who know you better, they definitely ask कि भाई क्या सीन है, तो साइकेट्रिस्ट के पास गए, दिखा क्या सीन था. Well, there are two kind of people in that. People who ask with real concern and people who ask to mock you or to really to get gossip, to get content out of you.
To get that content out
Yes.
of like शाम की चाय मस्त निकल
Exactly. So you will know which people are asking you out of concern and which people are asking for gossip. But either ways, we should again here, it is tough, but we should normalize कि हाँ कुछ स्ट्रेस चल रहा था लाइफ में, थोड़ा सॉर्ट आउट करने के लिए गया था सर से बात करने. नीड नॉट गिव ऑल द डिटेल्स आउट ऑफ इट बिकॉज दे आर नॉट गोना डू एनीथिंग अबाउट इट. तो यू कैन जस्ट से दैट देयर वाज समथिंग इशू गोइंग ऑन इन माई लाइफ एंड जस्ट टू गेट सम क्लियरेंस, यू नो, थोड़ा डीक्लटर होने के लिए आई जस्ट वेंट टू स्पीक.
ओके, सो व्हाट आई कैन कंक्लूड इज लाइक ऐसा नहीं है कि उनके क्वेश्चन से तुम भागो, जस्ट बी योरसेल्फ. Don't
Accept
be overacting in anything. Accept it. Okay, मैं गया था, मेरे को कुछ प्रॉब्लम थी.
Acknowledge करना है कि तुझे कुछ प्रॉब्लम था. Accept करना है कि you went there and you should be okay to vocal it out that yes, I have taken help. It is okay to take help. जब तुम बोलेगा कि I went and took help, that will normalize people कि yes, it is okay to take help. Because if you don't accept that you took help, people obviously saw you there. Means they will get more suspicious कि क्या चल रहा है.
Okay, if मैं उनके क्वेश्चंस को अवॉइड कर रहा हूँ, they will trigger their more.
Exactly, they will start gossiping behind you कि हाँ this person went.
और रिस्पॉन्ड कर नहीं रहे तो और इतना क्या सीन है.
हाँ, और रूमर्स बढ़ते जाएंगे कि अगर वो प्रॉब्लम इतना से ही होगा, लेकिन people start thinking so much and that will add up to your stress more. In order to prove them wrong, you have to take a lot of other more tension load.
Yes sir. So okay, इस चीज़ में एक चीज़ मेरे को लगती है, okay, mental health सबके लिए प्रॉब्लम्स है, like we are talking about generalize. बट आई थिंक एक चीज़ है जो मैं स्पेसिफिकली कुछ लोगों के कहना चाहूँगा रिगार्डिंग AIQ, नॉट AIQ और द ईच एंड एवरी इंडिविजुअल हु इज चेंजिंग देयर होम टाउन, देयर सिटी, देयर स्टेट फॉर द पर्पज ऑफ एजुकेशन. लाइक आई थिंक उनके लिए चीज़ें बहुत सी चेंज हो गई. इफ टेक ओके, जैसे मैं मेरा एग्जाम्पल ले लूँ, आई एम फ्रॉम जोधपुर राजस्थान, और मैं 11th तक मैं जोधपुर में पढ़ा हूँ, होम टाउन. मम्मी के साथ स्कूल गया, वापस आया मम्मी के पास, like the mama's boy, like not kindly the mama's boy, but okay with the family 24/7.
Complete homebred.
हाँ. फिर जब 12th में प्रिपरेशन करने के लिए, नीट की प्रिपरेशन करने के लिए मेरे को जब कोटा जाना पड़ा, सो इट विल बिग स्टेप फॉर मी एंड फैमिली. लाइक अब क्या तू अलग जा सकता है, बिकॉज लाइक फैमिली के लिए अगर आप 12th में भी हो बट स्टिल यू आर दैट लाइक क्या करेगा, कैसे खाएगा, वाज लाइक दैट. सो दे ऑल केम टू कोटा जस्ट बिकॉज ऑफ मी.
राइट.
सो आई वॉज लाइक ओके, लाइक हर कोई साथ ही तो चल रहा है, समस्या क्या है. सो ओके, कोटा गई, 1 साल अच्छा लगा, सिलेक्शन भी हो गया. बट जब मैं वहाँ से सिद्दीपेट आ गया, लाइक जोधपुर टू कोटा 400 किलोमीटर, मेरे से वो 400-500 किलोमीटर में ऐसा था यार अब लाइफ कैसे हो जाएगी. बट तब उन्होंने कंपनसेट कर दिया, चाहे हम भी चल लेंगे, कोई प्रॉब्लम नहीं है. बट आई नीड टू एक्नॉलेज दैट वो यहाँ नहीं आ सकते.
राइट.
सो यहाँ आने के बाद आई थिंक बहुत सी चीज़ें चेंज हो जाएगी. पहले तो जो मैं फैमिली के साथ था सिंस लास्ट 18 ईयर्स, अब मैं उनके साथ में नहीं हूँ. कल्चर चेंज है, फूड चेंज है, लैंग्वेज चेंज है. आई थिंक लाइक इफ मैं अगर फ्रेंड्स बनाना भी चाहता हूँ, आई थिंक लैंग्वेज विल बी अ बैरियर. लैंग्वेज विल बी बैरियर. सो आई थिंक उन स्टूडेंट्स के लिए या फिर जो अभी एजुकेशन स्टडीज़ के लिए स्टेट चेंज करते हैं, सिटी चेंज करते हैं, आई थिंक दैट कल्चरल शॉक काइंड ऑफ थिंग. तो उनके लिए जो मेंटल हेल्थ प्रॉब्लम्स आती है, लाइक उनको कैसे मैनेज करना चाहिए.
Anybody for that instance. Yeah, you gave an example of yourself कि like you came from a place different from what the place you're currently studying, and MBBS काफ़ी long journey है. It's not like 1 year or 2 year जो preparation जैसा है. It's like 4.5 plus 1 year. That's like 5.5 years of journey. And this is where you're adulting also. Like you're growing up from a young person to an actually a mature adult. थोड़ा financial independent होना चाहते हो, friendships बनाना चाहते हो, relations में जाना चाहते हो. There's so many things which people want to evolve in this time age period. That's like 18 years to 24 years of time में you are evolving into a very mature individual. And at that time, you are saying that you are relocating into a completely different place where the people are not like you. The people don't speak the mother tongue or the language you speak. The people don't eat the food you eat. Yes, it is very difficult. So, but if you think it in a negative way, definitely it is hard for anybody to adjust to that situation. But I feel one should see the beauty of it. That is the beauty of opportunity which our profession gives us, that we all are medical doctors as a community and we need to mingle with each other to get the better out of each other. For example, hypothetically, if you say you got a seat in Jodhpur only, do you think you would be learning another language, you'd be getting to know about different cultures, you'd be as mature as and more adjusting as you are now to situations?
Okay. Nice, sir. और I think एक बहुत सी चीज़ सीखने को मिलती है. Like earlier I don't know how to book a flight, how to book a train.
Right.
Like I even don't know frankly how large that Telugu language is.
Right.
Like we don't know actually. We don't know that community is there. Like actually we don't know.
You don't know this place exists also, and you don't know what exactly happens in this place. Like लोगों का सोच और what are the feelings and attitudes towards the society, culture क्या है.
Different cultures.
Exactly, you don't know. So this जो AIQ का shuffling system है, shuffling माने like if you opt in a place different from your place, like people might go from south to complete northeast. He might be a very Tamil Brahmin and he might get a seat somewhere in northeast in Assam where it's a tad bit hard to get some vegetarian proper food.
Proper.
Yes, if you're placing Guwahati Medical College, it's a very good college. And you're down from the south, you're some Tamil or Telugu guy who is completely vegetarian. It is really going to be difficult. But for the college sake, for the degree sake, you have to go. Because you are progressing in your career. You can't say, नहीं मेरे को नहीं जमेगा वो place, I would rather take a private seat in my city or something. It's going to be difficult, right?
Point.
See, that is an individual choice. There are people who do that also. There's nothing wrong with that. आप ये सोचना कि should I be taking this or not? अगर लिए तो क्या advantages होगा, अगर नहीं लिए तो क्या disadvantages होगा और advantages होगा. You should have the risk benefit ratio तुम manage करके वो खुद का डिसीजन, इन्फॉर्म्ड डिसीजन लेना चाहिए. इट्स नॉट लाइक हाँ साउथ में सीट मिला, मैं नॉर्थ का हूँ, साउथ में सीट मिला तो साउथ में सीट नहीं लेना चाहिए, मैं साउथ का हूँ, नॉर्थ में सीट मिला तो नहीं लेना चाहिए. द लैंग्वेज, द स्टेट शुड नॉट बी द रीजन फॉर नॉट टेकिंग ए सीट. इट्स अबाउट वॉट यू वॉन्ट इन लाइफ, what you want to progress, and what are the opportunities you're going to miss out if you're not taking it, and what you're going to miss out if you are going to take it. You make an informed decision. अब काउंसलिंग के बाद तो इतना तो टाइम देगा था, NMC will give that time. तो you have a chance to make that decision, and I'm pretty sure it's not going to be easy.
Yes, actually.
That is what is called adulting, bhai. Putting you in a different situation, in a difficult situation, and making you a better individual.
Okay. So what I can conclude is like just accept that changes are there and take it in a positive way so that you can learn more, you can grow more.
So one more problem which these people face, especially if you're placed in different state or language region, most people, they go with this fixed or a very closed belief system when they go to a different place, and problem arises at that point. I feel people who are relocating into a different area or a cultural group should be more open and flexible with their approach. They should be more accepting of the culture into which they're going. Vice versa, the people who are there should be more open and accepting to encourage these people to come into their place.
Point. Like
it's not
of both.
Exactly, and the host should be welcoming to the guests, and the guests should be coming with an open mind and agreeing with the rules of the place. अगर तुम किसी का घर को गेस्ट जैसे जा रहे हो, उसका कुछ रिवाज है, कुछ रूल्स है कि इस प्लेस में ऐसे ही चलेगा. You should be not saying like मैं इतने साल ऐसे था, I can't be. You are going like a paying guest.
Yes, sir.
You can't say that I was brought up like this, I will be like this. थोड़ा बहुत tough रहेगा, but you should be open and flexible to it. And these hosts also should be open and welcoming and respect your attitudes also. Ki this person came from a different place. He's not like us, so we should also be a bit flexible and open. The problem in medical colleges is that most people ये host और ये guest का ना ज़्यादा जमता नहीं है.
Actually,
these people are not so open and these people are not so flexible, and they become a very secluded group.
Even I agree कि जो minority men, not like minority, जो seats कम है,
Right.
even they make their own groups.
Right.
Even they feel like I don't need anything. They also can't be like okay come. They also can't be like, and they also make their own groups and they are also get satisfied.
Right. So language is a very important thing for communication. I know it is tough to learn a language within a short span of time, but at least you can try.
Yes.
Many people, because of the fear that their language might get mocked or because they can't speak in their language, they often don't make friends of different regions.
Point.
For example, hypothetical, I'll take you again because you are only here.
Yes.
So you are placed in this place. This is a Telugu state and you are from the north who speak Marwari or Hindi. So you come here and you might have so many friends in your class who speak Telugu. It might be very natural for you to have a difficulty to talk to them initially, to introduce yourself and say that I'm from so and so place and mingle around with them after a couple of time, because everybody will be conversing in their regional language and you will be like having a question mark on your face, like are they talking about me or they joking about something else. हमेशा तुझे subtitles की you need subtitles for every statement.
First time I came to Hyderabad, so in Hyderabad station train number 135 platform number idilo.
Right.
So it was like also changing from me. So the thing is, I should accept also. Like it changes there, but okay, I can do this.
It's not hard for anything. Nothing is impossible, I feel like, because you can learn language. It needs a little bit of effort and good company and support to learn a language. Movies तो है. अभी तो ऑल इंडिया मूवीज भी चल रहे हैं. पैन इंडिया, नॉट ऑल इंडिया, पैन इंडिया मूवीज भी चल रहे हैं. तो there's a lot of cultural exchange happening and people are actually acknowledging that yes, anything can be reached out anywhere if there is a motivation to reach out.
Okay.
I think you can learn from the movies is this thing.
Point. अच्छा, एक चीज़ जैसे ये है कि जैसे एक तो चलो उनको प्रॉब्लम्स आती है, एक जनरलाइज्ड प्रॉब्लम जो मेरे को लगता है मेडिकल फील्ड में है, सीनियर जूनियर रिलेशनशिप. आई थिंक ये प्रॉब्लम पहले मेरे को लगता था ये प्रॉब्लम शायद MBBS में है, बट सॉरी बट it's not like that. It is there in internship, it is there in kind of JR, it is there in like, because I think in each system there is a hierarchy. Juniors है, उनके seniors है, उनके ऊपर interns है, उनके ऊपर JR है, SRs है, assistant professors है, even HODs है, for you HOD is there. So I think a little bit toxicity is there in this field. So ऐसा कुछ है कि इस field में toxicity है और is it there everywhere?
What do you think?
I think इसमें ज़्यादा है.
इसमें ज़्यादा है. See, we can't quantify toxicity is everywhere. Toxicity is a state of mind. We can't point out to a profession and say toxicity is there. I'm not saying toxicity is not there in medical profession, and I'm not saying toxicity is there only in medical profession. Toxicity is a state of mind.
Kind of.
Because toxicity किधर से आता है? It comes from the people. And जिधर वो toxic people है उधर toxicity रहेगा. If they're good people, why will there be toxicity? So when you speak about senior junior relationship, I always tell my juniors, and I always believed in this thing, that always be the type of senior you always wanted to have as a junior.
Yes sir.
I mean like it's all this rivalry तो चलता, rivalry नहीं बोलूँगा, लेकिन this little bit of friction between the senior and junior because they're a bit senior to you, or in age or in wisdom or knowledge. Wisdom नहीं बोलूँगा, knowledge, age. So it might give them a little bit of more authority over you, but problem comes when the seniors feel that उसका हक है कि they can rule over the juniors. Okay, senior की तरह you can be a bit more like, you can tell them how to do stuff, or you can just rub off your workload over them. It's pretty normal. वैसे ही सीखते हैं हम. It is when I leave off my work for you, that is only when you will learn. इतना तो बनता है.
ये कि instead of books I will learn much more from my seniors.
Right.
In the hospital the practical knowledge जो है वो मेरे को मेरे seniors से ज़्यादा मिलेगा instead of books.
Exactly. Suppose if I'm a surgical resident or surgical resident, and if I do all the suturing, what is there left for you? I can just say, अरे भाई तू सूचरिंग कर ले, मेरे से नहीं होता. दैट इज व्हेन यू गेट एन अपॉर्चुनिटी कि यू कैन ऑल्सो लर्न. यू विल ऑफ कोर्स लाइक अरे ये सर तो हमेशा मेरे पे काम डालते हो, बट एट द एंड even if you're angry or pissed off, you're frustrated on me, you're learning something. Maybe this moment will help you somewhere else in your life. Or there's a fine difference between putting out the workload always on you and there's a fine line between on the other side, like helping you to learn. Not all seniors are sweet ki bhai tere liye hi kar raha hu. They won't say. They'll just throw off their attitude ki bhai tu kar le kaam. It's an indirect way of making you learn or do the work. Not that they can't do it. And as well there are seniors who are like they don't want to do, they always want the juniors to do. These seniors, this type of seniors should change. Whereas the other type of seniors who wants to encourage you to learn should be there. I think उतना तो बनता है. That kind of thing is good. Let's not glorify or make a fairy tale out of a medical college. We are not in a Karan Johar movie where everything is like all perfect.
Expectation तो वही थी actually. We are from 19 batch. हाँ. और जो मूवी 19 बैच का सिलेक्शन था उससे जस्ट पहले आई थी वो थी कबीर सिंह.
अच्छा.
तो जब मेरा कोचिंग का जो सेरेमनी होता है, जो विक्ट्री सेलिब्रेशन काइंड ऑफ, तो उसी दिन वो मूवी आई थी. तो और आई थिंक 2019 से पहले इतने स्मार्टफोन्स वगैरह थे नहीं कि एक्चुअल मेडिकल, बिकॉज आई थिंक जो लोग मेरे को आज काउंसलिंग से पहले डाउट पूछते हैं, हाउ मेनी कैडेवर्स आर देयर इन योर स्कूल.
राइट.
For me, I don't know what we'll do after getting the medical college.
You just know that you have to draw diagrams on Preeti's hand.
We don't know anything. Kind of we can expect that, but we don't know that time like what we're gonna do at that. But now.
Yeah, see the information. See now we have a lot of social media which has increased. A lot of communication has increased. On a click of everything, you have information everywhere. You got contacts of many people in various institutes. Then you can find out what is the faculty है, कितने PGs है, कितने seats है, recognized है कि नहीं, कभी recognition गया, how are the hostel facilities कैसा है, कुछ लोग ऐसे vlogs बनाते हैं तुम्हारे जैसे लोग. तो we have content out there which will tell about individual colleges. Now I think this generation is a bit advantageous over the previous generations about selecting colleges. Definitely, thanks to people like you who help people with such things.
Okay, how is your MBBS? Ragging हुई थी?
Ragging is a subjective term. Ragging interaction के नाम पे तो बहुत नहीं interaction के नाम पे तो बहुत कुछ हुआ है. तो like I am like very like almost like 10 years earlier than your batch. You're 19. I am a graduate of 2009 batch. So things were pretty different back then. It was a good MBBS college and like we had good memories. The administration was also quite good, little bit of strictness, little bit of leniency. Academics mein to they were very strict because they wanted us to be good doctors. And they were a bit vigilant about the outings and all that, attendance ke bare mein. We had our own loopholes and all that, but somehow we cleared it off, and then the actual movie started after MBBS.
Like when we first memory, like आपको लगता है यार ये चीज like for me also I expect something like the dream Karan Johar kind of medical school. So for you also have expectation in 2009 also like we will do that this. So the worst memory you can recall like okay ये क्या ही हो गया मतलब in the MBBS.
नहीं worst memory नहीं कहूँगा कि मुझे एक shocker like it came like a shock like ऐसा भी होता है. So I had that moment कि like all throughout my childhood I was in a co-education school.
Okay.
And I was surrounded by friends usually from the north.
Okay.
And south people also. And it was pretty chill, cool. Like we used to hang out, friends, boys, girls, and all that. And suddenly I am placed in a college which is kind of in a suburban area only, not in the city.
Okay.
And
kind of SIDDIPET.
No comments. So I was placed in a college which was in suburbs only. So it was like when I on the orientation day when like no boys and girls can roam around in the campus, there are no common outings for them and all like what? काफी उम्मीदों से आते हैं मेडिकल कॉलेज को. एक तो डॉक्टर बनने और दूसरा तो like so many things we want to do. So like I was like okay, so that was a very big shocker or thing for me.
Expectation versus reality kind of thing.
Right. That things came, and I'm glad that now it's not the same anymore. Things have changed.
In some colleges only. In some colleges only.
Okay. So yeah, if I can say in 2009 it was like that, now it's 2023, like 14 years after that. So एक वनवास हुआ है तो things should change.
Because like first जैसे मेरे को ये चीज़ लगी थी like mostly students को I think वो फेज होता है कि आपने पहले पढ़ाई की होती है, ऐसा नहीं आप पहले पढ़ जाए. आई थिंक आपने नीट यूजी क्लियर किया, मीन्स यू आर इंटेलिजेंट, यू आर हार्ड वर्किंग काइंड ऑफ.
राइट.
बट एक जनरल मेरे को जो लगता था कि मेडिकल कॉलेज में आने के बाद पढ़ना है, बट इतना तो मतलब शायद ही पढ़ना होगा, मतलब बिकॉज आई थिंक मेडिकल कॉलेज को कोचिंग इंडस्ट्रीज ने इतना ग्लोरीफाइड कर दिया ना कि योर ओनली गोल इन लाइफ इज जस्ट टू क्लियर नीट यूजी. एक बार ये क्लियर कर लो, योर लाइफ विल बी लाइक एनीथिंग, मतलब क्या ही मौज हो जाएगी तुम्हारी. बट जब इधर लगे तो आई थिंक फर्स्ट इंटरनल में फेल हो गए थे, तो फिर लगा कि यार फेल होते हैं, पढ़ना भी पड़ता है. तो स्टार्टिंग में रिकग्नाइज हो रही मेरे को जो बुक्स थी, लाइक जब बीडी चौरसिया, लाइक जो हर कोई जानता है, इवन कबीर सिंह मूवी में भी बीडी चौरसिया को दिखाया गया है.
राइट.
तो मेरे को लगा ये तो शायद ही पढ़नी होगी, लाइक ऐसा कुछ नहीं, इसको पढ़ना होगा. लाइक फर्स्ट ईयर के एंड तक मैं ये एक्सेप्ट नहीं कर पाया कि मेरे को ये पढ़ना है. तो ये एक बहुत बड़ा चेंज है कि लाइक इट इज़ अ चेंज, बिकॉज आई थिंक कोचिंग इंडस्ट्रीज में लगता है कि एक बार ये क्लियर कर दो फिर पढ़ना वढ़ना कुछ नहीं, बस लाइफ में मौज लगी पड़ी है. बट ऐसा नहीं, पढ़ना पड़ता है, लाइक स्टडी इज अ पार्ट ऑफ लाइफ.
आई थिंक दैट ग्लोरिफिकेशन हैपेंस फ्रॉम 10th स्टैंडर्ड ओनली. 10th क्लियर कर लो, लाइफ सेट है. 12th क्लियर कर लो, लाइफ सेट है.
बट ऐसा लगता था कि नीट यूजी वो बहुत मतलब
राइट, बिकॉज दैट इज यू आर एंटरिंग ए मेन डिसिप्लिन ना. यू आर एंटरिंग इनटू मेडिकल स्कूल, लाइक डॉक्टर्स है, लेकिन वी नो हाउ द स्टेट इन द कंट्रीज ऑफ डॉक्टर्स. सो like yes, it is glorified, and getting into MBBS is a really a matter of honor for many people, but only the people who are in it will know the whole grind of it.
Point.
So you enter this school with a lot of expectations, because तुम NEET के लिए you will be like grinding yourself to the hardest core, like completely extreme. Like you'll be totally working extreme. For 18 hours or 16 hours without sleep, all nighters pull off करोगे. तो इतना efforts के बाद of course your brain and your mental ideology will be like हाँ चलो हम मतलब थोड़ा रिलैक्स हो जाएंगे. अरे फर्स्ट ईयर ही तो है, 5 साल की डिग्री है, फर्स्ट ईयर में क्या उतना है. बट एवरी ईयर हैज इट्स ओन इम्पोर्टेंस. करिकुलम वैसा है, देखो 19 सब्जेक्ट्स है, तो द करिकुलम इज ऑल्सो मेड इन सच ए वे दैट यू हैव इक्वल स्ट्रेस एवरीवेयर थ्रू आउट द 5 years. और अभी तो करिकुलम चेंज हो रहा है कि आई थिंक सो मेनी सब्जेक्ट्स आर बीइंग शफल्ड इनटू वेरियस ईयर्स. Many of the clinical subjects are into the final year now and all that stuff, no? So with a lot of hard work you have done so much for your 12th grade after getting into NEET, your mind will be in a state ki let's relax for a while. But then reality will hit you. Internals आ जाएंगे, कुछ कॉलेज तो स्लिप टेस्ट रखेंगे, कैडावर के सामने तुम पेक्टोरल्स मेजर बोले तो तुम पेक्टोरल्स माइनर को टच करोगे. तो it's not only, then you'll realize that it's not only about studying, it's about applying that knowledge into your daily life also. It was not like रट्टा मारो कि फिजिक्स में ये फॉर्मूला था, v is equal to ut plus half at square. No, it's not anymore like that. It's when you identify those things in your body and you try to understand your body's mechanism, all that things happen, and that is again a different dynamic. That is again your level 2. Achievement unlocked. You're entering the second stage. And then next achievement for you in the future, people are preparing for PG, level 3, another achievement will be unlocked where you will actually start focusing on one subject only, and that will be all together be a different ball game.
So I think NEET UG aspirants ये समझ ही होंगे कि किस चीज़ की बातें चल रही है.
तो yeah, you have to study. I see, and many people सोसाइटी में ये इमेज कि अरे तू तो डॉक्टर है, तुम्हारा तो 24/7 पढ़ाई होते होगा, तो क्या पार्टी भी करता है.
ये भी मेरे को लगता है कि मतलब
they have a complete different notion about doctors कि तुम तो डॉक्टर हो भाई, ये क्या ड्रेसिंग है, रिप्ड जीन्स पहनते हो, टी शर्ट पहनते हो, तुम तो फॉर्मल्स पे रहना चाहिए,
लग भी नहीं रहा डॉक्टर हो ये.
हाँ एग्जैक्टली. तुम्हारा तो क्या स्पाइक्स डाल रहे हो, हेयर कट, ये तो डिसेंट रहना चाहिए, दाढ़ी वाड़ी क्या है. तो वी हैव a stereotyped image of a doctor. But luckily, I think it's been changing of late. Like this was there back then when I started wanted to wear torn jeans. I got it from my parents and my relatives. क्या रिप जीन्स पहन रहे हो तुम, और डॉक्टर हो, डॉक्टर आदित्य. हाँ, what is this? You need not beat up yourself just because you're a doctor. But when times come where you need to work hard, you have to work hard, and you should be planning properly because it's a very long journey. Failures तो रहेंगे because failures only will teach you where you lack, and you should learn from that. And that doesn't endorse me the fact, I don't endorse the fact that you should fail in your MBBS exams. I'm
you
not
should pass.
You should pass. Failures माने you should, if you're not getting something right, you should accept that yes, there's something wrong going around in the way which I'm preparing, and I should be working out or redoing something about it. So just because you failed an internal or failed maybe a non-professional exam for that instance, shouldn't make you feel low about yourself or make you feel कि I am unfit for this profession, कि भाई मैंने तो क्या ही सोच लिया और I came to MBBS now मैं तो फंस गया. I can't go back nor I can't go forward. I am constantly being failing over here. मेरा attendance ही नहीं है. Because many people have this issues कि they don't have attendance problems, they don't have internal marks, or they are not allowed for exams for various reasons. It can be any reasons. Let's not go into the reasons. So these all are the obstacles which happen in majority of people's life, and these should not be something which stop you from pursuing what you are fit for. The fact that you entered medical school itself is an indicator that you are capable enough of clearing it. Okay. If you're not able to clear it, that means there is some fault in the efforts which you're putting. You're not putting your efforts in the right way. That failure should give you an opportunity to rethink, retrospect what you're doing, and then redo things in a better way, and definitely people can clear it. अगर attendance की कमी है तो सोचना पड़ेगा कि क्या चल रहा है बॉस. Why am I not having attendance? Am I being very complacent कि हाँ देख लेंगे last में attendance, or am I enjoying too much enjoyment कि I'm missing out on classes? अगर internal marks कम है तो where am I lacking? Like, am I not revising the important topics, or am I just reading it too vaguely? Am I not reading it or not revising? Like, you can read, but for exams you need to revise. Am I not revising it?
Kind of like you need a work-life balance.
True.
Because I think work will be more, but you need life too. So you need to balance both the aspects.
And many people, they don't perform well because they have a lot of stress before the exams.
Point. Because I think mostly stress लोगों को वही है exam stress. Because I think like stress kind of, if you want to divide, like some is personal, professional, and professional mostly because of exams, like before exams, like mostly that is stress.
तुझे exam से stress होता है?
नहीं.
अरे what is the first student who told me exam से stress नहीं होता है? मुझे तो होता है भाई exam से stress, because stress is a
बहुत negligible.
ठीक है, I agree. You don't have stress. Let's okay. I'll take that statement. So okay. Jokes apart, stress will be there with most of the people. Like exam है, somebody is going to assess you for something. तो of course you'll be a bit anxious and you will be worried कि क्या होगा, क्या questions आएंगे. वो uncertainty तो तुम्हारे दिमाग में वो कीड़ा चलते रहेगा कि क्या पेपर आएगा, अगर मैं the topics which I studied or not will come or not, or what if the topics which I actually skipped and thought are not important will come. तो ये uncertainty, ये anxiety is pretty normal. Like, I don't think there's any student who is not anxious before exams.
I think mild, like एक नॉर्मल लेवल स्ट्रेस सबको होना ही चाहिए, like kind of to perform well.
हाँ, वो परफॉर्मेंस के बारे में है, लेकिन वो एग्जाम का नाम लेते ही सबका एंग्जाइटी लिटिल बिट तो होता है. इट इज नॉर्मल, राइट, नॉर्मल ह्यूमन रेस्पेक्ट. एग्जैक्टली. तो हाउ कैन वन डील विद दिस इज मेनी पीपल डोंट प्लान प्रॉपरली. देखो, मेन एग्जाम्स तो 1 साल के बाद होता है, ये इंटरनल्स तो 3 या 4 महीने में होता है या 6 महीने में होता है, डिपेंड्स ऑन द कॉलेज एंड द यूनिवर्सिटी. So most people start studying 15 days before the exam.
Okay.
Like, you enjoy 4.5 months of your MBBS and you start focusing on 1.5 months before the exam. That is where the problem is. You have to chart a schedule, and before the exam you should be well informed and well versed with the topics. Okay. See, no ever medico can reproduce exactly whatever there is in the textbook. It's all about you writing what you understood in your own way. You really can't mention Park ke dialogues or like ENT Dhingra ke dialogues or any other book, Khurana ke dialogues, considering third year subjects. So what you understood is what you're gonna put back. So if you plan accordingly, हफ्ते में, if not daily, हफ्ते में 4 दिन तो पढ़ूंगा मैं, at least 2 hours this subject, I think you're sorted for your life. Like, you won't have that much of anxiety which is going to hamper your performance. क्योंकि बहुत सारे लोग all nighters pull off करते एग्जाम के सामने, एग्जाम के पहले. Yeah, I've seen you. Your status is 4 a.m., 5 a.m. So yeah, so there are some people who are good at it, but for most of the people it shows a negative effect because first you're sleep deprived. Sleep कम है तो तुम्हारा attention span, जितना भी पढ़ोगे तुझे फिर से वो अंदर मेमोरी से यू हैव टू ब्रिंग इट आउट बोले तो दैट रिक्वायर्स सम एनर्जी, एंड अगर इफ यू स्लीप डिप्राइव्ड दैट एनर्जी इज लेस.
ओके, इफ लाइक एक पर्सन नाइट स्टडी करके, ओके, लाइक टेक फॉर माय एग्जांपल, एट द टाइम ऑफ नीट यूजी माय स्टडी आवर्स लाइक फ्रॉम 9 PM to 7 AM. Then I got sleep at 7:30 and wake up at 12. So it can affect my mental health. Like at that time it doesn't affect my mental health. Like I was totally okay. So is it true कि like अगर आप night में पढ़ते, because I think from the parents perspective view कि रात को मत पढ़ो, रात को सो, बट काफ़ी स्टूडेंट्स का वो है कि उनको नाइट में पढ़ाई अच्छी होती है.
क्यों अच्छे होते हैं?
बिकॉज आई थिंक मेरे लिए शोर ही नहीं है, कंप्लीट शांति है.
That is the most common reason which why all medicos prefer to study at night, because they can be in solitude. कि ज़्यादा there's no disturbance outside, there's no mummy calling you for food, there's no daddy saying why are you on your phone, there's nobody asking you what are you doing, nothing. So many people prefer to study at night. All said and done, there are people who do that. No offense, but your question was, will it affect you on the long run?
Okay, like
it will affect you because sleep deprivation, there are multiple research studies saying that sleep deprivation will cause memory disturbances and affect your.
If I can complete my sleep in daytime, like
हमारा बॉडी का एक सर्केडियन रिदम होता है ना, तो एग्जाम्स के पहले ही तुम you're doing that. That will alter your whole chemicals, your melatonin, your cortisol, ये सब, go back to physiology 101. So all the things, there's something called as a reticular activating system in your brain. Okay. Let's not get into the details, but there are a lot of dynamics which are happening in your body which will hamper. अगर वो 1-2 दिन का है तो ठीक है, but if you're doing it on a long term basis, on a chronic basis, every time you're getting exams, see in your teenage years, especially in your UG NEET preparation, it's okay, but as you progress, you're turning into an adult and your body is also changing. That will affect you in multiple ways. You might have some mood disturbances because of lack of sleep. Okay, that might hamper your daytime efficiency. You can't say I'll do an all-nighter and subah I will sleep. No, because you have work to do. Okay. You have got people to talk.
Like आपका शरीर बना ही ऐसे, आप नाइट को सो like harmonically.
Exactly. Sunlight will activate your brain
from the retina point of
right view. And darkness will cause sleep in your brain. That is how we are made. Okay. So if you're trying to change the dynamics, definitely it's going to change your brain, the way you're thinking also.
Okay. So for long run, like
in the long run, it is going to affect you. It can affect you. But health. We all have done one-nighters in a life.
Like
once in a while.
That's okay.
It's
but
okay.
If you're doing on a long term,
it's going to affect. It's going to affect you. और नाइट आउटर्स तो खाली पीली नहीं करेंगे, कैफीन लेंगे, हम कॉफ़ी पियेंगे, रेड बुल पियेंगे, स्टिंग पियेंगे, मॉन्स्टर पियेंगे, तो ये सब भी स्टिमुलेंट्स है, आर्टिफिशियल स्टिमुलेंट्स है. दोज ऑल ऑल्सो विल हैम्पर इन योर. कुछ लोगों को और कई आदत रहेंगे.
अच्छा, एक चीज़ ये है कि आई थिंक हमारी जो मेंटल हेल्थ है वो मोर और लेस काफ़ी अफेक्ट पड़ती है हमारे फ्रेंड सर्कल से.
ट्रू.
लाइक फ्रेंड सर्कल आपका जैसा है तो दैट विल अफेक्ट योर मेंटल हेल्थ.
संगत का असर बोलते हैं.
संगत का असर. वही. सो आई थिंक एक और चीज़ है जो कि लाइक आपकी जो मेंटल हेल्थ है वो आपकी फ्रेंड सर्कल से अफेक्ट होती है.
ज़रूर.
एंड losing friend is a kind of part of MBBS, not MBBS, a part of time, a part of journey. Because I think first year to fourth year you will lose friend, kind of, we see like broadly circle goes smaller.
True.
So is it okay to lose friends?
Well, that is again an individual based question. Nobody will be okay to lose friends,
like
but
no one wants.
Nobody wants to lose friends. But as you told, first year में जितना quantity of friends रहेगा, as you progress further, the circle gets smaller. It turns to be like quality over quantity. The quality of friends will stay intact, and the quantity who came to you for some XYZ purposes will start to get away from you in your circle, as their needs are fulfilled. Or it might not be that reason also. There might be some internal clashes, there might be attitude problems, they might have some different meaning or purpose of life. You might have a different meaning and purpose of life. Your values might not match. They might seem to match on the surface level, but when you go core into the levels, your values might match. Then you might go apart. Or there might be girlfriend relationship issues where the other partner might not be okay with them being so interactive about interacting to you or anything else. Like they might be having a problem, so of course the friend has to oblige to the partner for some extent, and maybe I won't say losing a friend, maybe that relationship will a bit thinner. It will get thin over time.
Okay, it's not like cutting.
It's not like cutting, but maybe the interaction will get decreased over time. And see, that's what it is up to the individual to decide what they want in life. Whether they want to continue the relationship. And we should be okay with it. We should always, I feel, rather than mourning or like feeling sad over the fact that you have lost a friend due to a fight or a clash or anything, you can cherish the good memories which you had, because as much as we don't want it to happen, it is very natural and it is very, very common that you will start losing people once you start being more successful or more focused,
goal oriented,
because everybody wants to have fun, but once you start speaking stuff which are actually serious talks, not everybody will be there to sit. तुम भाषण दे रहे तो ज़्यादा लोग नहीं बैठेंगे, तुम गप्पा मार रहे तो ज़्यादा लोग बैठेंगे,
सब लोग बैठेंगे.
तो in that context only, if you are like for casual friendships and all, you will have so many people, like acquaintances ज़्यादा रहते, but friends, see basically हम लोग सबको friends मान लेते हैं starting में. Actually people are acquaintances. Acquaintance का English word होता है जो पहले बार मिले हो, उसके बारे में थोड़ा बहुत तुझे मालूम है. हाँ, there are ways to make, like अचानक instantly friends नहीं, love at first sight होता है, friendship at first sight नहीं होता है. तो acquaintances होते हैं. फिर after spending a couple of time or a good period of time together, when you feel that your values, your thinking, your attitudes are matching, that is when you establish a friendship or a bond. And if that is sustaining for a good period of time, then you become best friends. This is not a theory or a friendship theory which I have devised. It's not something scientific or something. I am just telling a vague way कि पहले एक आदमी को acquaintance होता है, फिर they start befriending them and then they get to know them better and then they become best friends. Relationship का भी वही हाल है. First you get to know, first you know them per se, then you get to know them, become friends. पहले तो सब बोलते हम तो फ्रेंड्स हैं, अचानक से हम तो लवर्स बन गए, तो इट ऑल स्टार्ट्स प्यार दोस्ती है टाइप्स में. सी सो दोस्ती का भी एक तरीका होता है, बट मेनी पीपल दे हैव दिस रॉन्ग नोशन कि अब फ्रेंड्स है तो फ्रेंड्स फॉर लाइफ है. फर्स्ट ईयर में ही दे बिल्ड अप सो मच एक्सपेक्टेशंस ऑफ पीपल,
बिकॉज आई थिंक
दे बिकम वेरी पॉजिटिव, दे बिकम क्लिंगी.
के स्टूडेंट्स की स्टोरीज लग रही है, 6 का ग्रुप है, V6 now in our 70s, V6, then they're just 1 month. So it might be that they're not that friends, but they're just connection. Like
that's what it is. Hard to know about a person in 1 month. And you have not spent much part of your life with them. It's only after at least 2-3 years you spend, or if you're hostel roommates or if you're roommates, you'll get to know the other side of them. Not only the good side or the happy side of the people, you will get to know when he's sad how they'll react, when they're happy how they'll react, when they're frustrated how they'll react. So are you able to manage and cope up with their frustrations onto you? Because अक्सर क्या होता है, हमारा frustration हमारे दोस्तों पे ही निकलते हैं. तो are we able to take that? Sometimes people are not okay to take that, sometimes people are okay to take that. So all these things make a play. Like of course, as you told, again coming back to the first initial statement, ki your friendship circle will come down.
But it's okay.
It is okay. It is okay.
It's okay.
People who will stay, and you should not be worried about the people who leave, because that is life.
Point.
Be it friendships or relationships, I feel.
So okay, जो एक चीज आपने mention की, that is relationship. So that will be part of life.
Right.
And breakups are part of life. So one question, like how to deal with breakups, or like how to move on from a person, or to detach someone from you, like after breakup or kind of stuff. How, like it is a problem.
Okay, very interesting topic. Relationships and breakups. As you told, breakups are inevitable part of anybody's life, I feel. I mean, I'm not saying everybody will have a breakup. There will be misunderstandings, relationship clashes. Let's not use the term breakup. There will be clashes. And if the clashes are happening for a longer period of time, it might eventually lead to a breakup.
Point.
So how do we avoid a breakup is one fact, and how do we move on from a breakup is one fact. So how
avoiding a breakup, kind of?
Avoid mane, it's kind of like primary prevention in SPM. Like how to not let things go till breakup. You have clashes. You just can't have like one day in the morning your partner comes to you and say, let's break up today. Obviously there's something behind in the background. Things were rough back in the background which might have led to this decision. So one thing is always retrospect on what your relationship is going on. How is it going on? What are the opinion clashes, and how you both can mutually evolve into being better for each other.
Okay.
That is one thing. You should be okay to disagree on few parts, it is okay to agree on few parts, and it is okay to say yes to some things that are inconvenient for you. It is okay to, do the vice versa. To say no also if the other person is inconvenient.
Like two person are not same.
Definitely.
With time you tell, okay, I like this, I don't like this.
Yes, you should
to express
yourself. You should be able to be vocal about it, especially the youth of this age. It's easy to make a relationship or break a relationship these days. Because
you don't need any authentication, you don't need any actually.
Authentication kabhi bhi nahi tha, lekin there's nothing. It's more like the attitude has shifted from a more committed relationship to a more situationship.
Situationship.
More,
actually,
it's a more new term.
New term.
So there's no hardcore commitment to anything. It's all casual attitude towards relationships. So it is very easy to get into a relationship. It is easy to break the relationship also. And I think with changing times, people are okay with breakups these days. But there are some sect of people which for them breakup is really hard. Especially if they're invested a lot of time into a relationship, lot of energy or their minds into a relationship or their heart in a relationship. So it is definitely hard for them. So one thing is, first, as I told you with anything, first you have to accept that it is a breakup. Don't be in a denial.
Sometimes breakups are good.
Yeah, definitely.
Because it happens at this point. What if happens at 5 year, like from 5 year now?
वो तो कभी भी है. that advantage, that benefit of doubt is always there. कि अभी हुआ है, thank God अभी हुआ है. शादी के बाद तो नहीं हुआ, thank God. Or like 10 years down the lane, 5 years down the lane तो नहीं हुआ. Because that is always there. But what I'm trying to say is, breakups अगर हुआ तो first accept that the breakup has happened, that the partner and you are not going to be in a relationship. क्योंकि सब लोग ने ज़्यादातर लोग डिनाइल में रहते हैं. they'll think that शायद कुछ और एक और चांस मिलेगा, एक और I think like I think I can work this out. So especially the person who's suffering, because usually breakup में ना at least 80% of things is one fellow is the sufferer, one fellow is the breakup proposer. The one who proposes the breakup. And the other one is the receiving end. There are 20 relationships where the breakup is mutual. सब लोग बोलते हैं कि breakup mutual था, लेकिन अक्सर रियलिटी में तो नहीं होता है ब्रेकअप म्यूचुअल. इट इज मोर लाइक वन पर्सन इज द वन हु इनिशिएट्स द ब्रेकअप, द अदर पर्सन विल रिसीव इट. सो द रिसीविंग एंड को ज्यादा दुख रहेगा. आई मीन ऑफ कोर्स इवन दीज पीपल, बट दे माइट हैव अ वैलिड रीजन. तो द ब्रेन विल हैव अ रेशनैलिटी कि हाँ इसके वजह से ब्रेकअप कर रहा हूँ बोल के,
ऑलरेडी
प्रिपेयर्ड. बट द वन हु रिसीव इट इज अ शॉक टू देम. So definitely they will be in that loop. They get into that sadness. They get into Kabir Singh mode, drinking, smoking, etc. and crying and all that stuff. So first you have to accept that it's a breakup and acknowledge that it is okay to have a breakup. Like, and you can accept the good memories or good learnings what you had from the relationship. See, breakups will give you a chance to understand yourself, according to me.
Okay, like kind of understanding the other sex?
Not the other gender, but like understanding yourself. More than understanding the other gender, it will give you an understanding about who person you are. Like, it will give you a scope of understanding what went wrong from your side. Ki the opposite person was not happy with you.
Okay.
Maybe the way you're expressing your love, maybe the way you're giving your time or not giving time to them, maybe the way you're over clingy or over possessive, maybe you're too authoritative or like too patriarchal over them. Ki, I am the guy in the relationship, you have to do like this only, you're my girlfriend, or like you're my boyfriend, you have to be like this only, you can't talk to other girls. So if you're too possessive, clingy, so breakup hone ke baad, that is a time of reflection. I feel like you should look into the mirror, not it's a metaphor. So you have to look into yourself and see like what went wrong that this relationship failed, and you should learn from the mistakes and make a better version of yourself. And the breakup is not the end of your life or end of your journey. Like there's definitely better things.
काफी लोगों को ये लगता है कि सब कुछ खत्म हो चुका है, and
like and yes, it of course it will take some time to come out of that that pit of breakup. I'm not saying overnight में you can't be too positive that like हाँ breakup हो गया, हाँ सर लाइफ में तो सर ने बोला तो लाइफ में तो breakups होता है, रिफ्लेक्ट करो, हम भी मिरर के सामने बैठेंगे देखेंगे या चलो अगला दिन हंसते हंसते. नहीं होगा वैसा. It will take time. What I'm trying to say is, don't dwell upon that fact for a longer period of time, and don't let it affect your personal life and your professional life. Personal money, not this personal, your interpersonal, like with your friends, your family, your health, your decision making capacity, and your career. क्या होता है ना, अक्सर लोग गेट इनटू रीबाउंड रिलेशनशिप्स स्पेशली आफ्टर ब्रेकअप. Rebound is like when you have a breakup,
Okay.
and immediately somehow you get some attention or PR from somebody of the opposite gender.
Okay.
And then you think that हाँ यही love है, or like you just to
she's the right
satisfy your ego or your deficit, जो भी वो deficit create हुआ है life में, उसको fill up करने के लिए you will replace that space with this person who's showering you with love and attention.
Rebound relationship.
It's called a rebound relationship. तो many people get into that, and थोड़े दिन अच्छा ही रहेगा क्योंकि एक प्यार करने वाला चले गया और दूसरा प्यार करने वाला वो रिप्लेसमेंट आ गया, you'll feel good, but most people end up having regret again after that. Like एक दो हफ्ते ठीक रहेगा, एक महीने ठीक रहेगा, उसके बाद कि like मैं क्या हूँ इतना, am I too easily available for people कि like एक चले गई and then I'm having somebody else, like am I so easy to pursue? तो people get in the regret mode, guilt mode में चले जाएंगे. तो you should be very cautious. Again, I'm saying it's an individual opinion. There are people who are okay with these things. It's their opinion. I respect that. And there are people who are not okay, but they end up unknowingly, unwillingly. So one should be very cautious and mindful when they make decisions like this, especially getting into bad habits, into relationships, rebound especially, or impulsive relationships, like it can be having sexual relationships or casual flirtationships and all that. Because I think you're just to satisfy your deficits in your life, you are creating a false hope in the opposite person also, and the other person will be at suffering.
Point.
So it is as a person who experienced a breakup, it is a responsibility also to not give that worst feeling to the opposite person also. So one should act responsibly when they're undergoing the breakup. I think one can pull it off in a better way. I think the best way is to focus on the positive mental health aspects, like you can divert those things and distract them into more positive things, like you can work out. You can work out, you can eat healthily, you can like put a lot of energy and focus and attention. Now that you don't have anybody to cater to, you can put your attention to your studies or your academics or your professional career, or you can spend more time with your family, because at this age, usually people detach with their families a lot. They feel like
frequency kam ho jati hai.
Exactly. So you can get more attached, and you can more enhance your relationship with your friends, family and all that. You can take that as a positive space, and everybody has two options in life. You can take the wrong path or the right path. Life will always put you in crossroads. It all depends where you want to go.
Okay. अच्छा, आपने जैसे जिम का बोला, तो how is physical health related to mental health?
अरे भाई, it is very important. It is as closely related as just like your breathing and your heart rate.
Okay, like one thing is many health fitness figures, like health influencers, okay, they told like if you have an emotional breakdown in your life, instead of going to a psychologist or psychiatrist, you can go to the gym. Is it true that like instead of going to a psychiatrist, we can go to a gym? Like gym is that or?
Well, I don't endorse that statement completely, but whether to go to a psychiatrist or psychologist is completely the choice of the person who's undergoing that situation. If he feels that he's unable to take that emotional stress and he's unable to cope up with that loss in his life, he can go to a psychiatrist to discuss the stress which he's facing. I am not saying everybody who has a breakup, they go to the gym, will have things sorted in life, they'll have positive mental health. No. Hitting the gym is one way of distracting and enhancing your self-esteem and your body, because working out will give you a lot of feel happy hormones, endorphins and all that. So that will make you a bit more feel lighter about the whole thing, and it is a thing like it's like a distraction. Like if you're sitting alone in room, it's rather better go and hit a gym where you can start focusing your body,
channelizing the energy to a positive way.
Right. That's one of the defense mechanism which we call sublimation, where we direct our negative impulses into more positive ways. ब्रेकअप हुआ तो ऑफ कोर्स तुझे गुस्सा आएगा, वो गुस्सा कॉल करके फाइट करने से बदले में इफ यू कैन फोकस दैट एंगर और एग्रेशन into a punching bag or onto the dumbbells or barbells, that will rather help you to vent out that frustration, and also it will give you a good physique.
Point.
And also it will give you happy chemicals in your body called endorphins.
Yes.
So I don't completely agree with the statement that instead of going to psychologist or psychiatrist, you can hit the gym, because that is not a universal statement.
Okay.
It might work for some people, but it's not true completely. If you feel that you are really in a fix where you are not feeling what to do, because some mental health issues need attention. देखो अगर एक बंदा डिप्रेशन में चला गया कि like he's not feeling interested in anything, he's always feeling low, he's feeling always wanting to be alone, feeling lost, not able to focus on his career.
Okay, that may be like a structural.
हाँ तो
structural damage with there.
एक structural नहीं, you not always have a structural damage in your brain to have a mental health problem. So it's a psychological state. तो तुम्हारा CT ब्रेन MRI निकाले तो भी ब्रेन इंटैक्ट ही रहेगा. तो इट नीड नॉट हैव अ स्ट्रक्चरल डैमेज. व्हाट आई एम सेइंग इज साइकोलॉजिकल इम्पैक्ट हुआ है, एक ब्रेकअप हुआ है, तो ए पर्सन इज अंडरगोइंग ऑल द साइंस ऑफ डिप्रेशन. तुझे जिम जाने की मोटिवेशन ही नहीं रहेगा. फर्स्ट ऑफ ऑल, इफ यू से टू अ पर्सन इज डिप्रेस्ड बिकॉज ऑफ अ ब्रेकअप, say that bro, you go to the gym, work out, you'll feel good. That bro is not having motivation to wake up from bed and eat food only. What about going to gym? So in that scenario, you have to encourage him to speak about his issues and consult a mental health professional. It can be a psychologist, it can be a mentor, it can be a psychiatrist, anybody who can give proper, ethical and evidence-based advice. People who are like easily able to cope up with that and just need some distraction, maybe hitting the gym is a very good alternative rather than going to a mental health professional.
Okay, you discuss psychologist. Who is psychiatrist and who is psychologist?
Okay, that's a very good thing because people need to know the difference, because often many people interchange the meaning.
Dimag ka doctor.
Right.
Same thing.
Right. So psychologist is a person who is recognized by the who is a person who is a degree graduate, BSc or a MPhil degree graduate, who is certified to do counselings, to do diagnostic psychometry techniques, like giving psychotherapies and all that. Whereas psychiatrists are doctors, medically qualified doctors, who along with the abilities of a psychologist can also prescribe medication for mental health disorders.
Okay.
So if you can draw a circle like a psychiatrist and psychologist, there's an overlap. Like a psychologist, what all a psychologist can do, a psychiatrist can do.
Okay.
What the extra psychiatrist can do is they can also prescribe medications.
Pharmacology department.
Right.
Okay.
That is the basic funda. I'm not going into the details. So that is the basic difference. कि psychologist वो होता है कि जो who is certified to counsel, give therapy and motivation, coaching and all this. Again, coaches are different again. I'm not using the word. So who can counsel and give therapies, and do diagnostic psychometry. Whereas psychiatrist is a person who is a medical graduate, has done an MD degree and is certified to diagnose, treat with pharmacological and non-pharmacological methods. That is therapy.
Like, is it true कि every time you need a psychiatrist or a psychologist, there's nothing like self-help that we can do on our own? Like, I have an exam every month. And before exam, I know that I have stress. So what I can do on my own? Or again and again, I need to go psychiatrist, have a consultant or psychologist, need a therapy or...
Well, for that question, again, you might need a psychiatrist or a psychologist every time, or you might not need a psychiatrist or psychologist every time. See, एक sitting में, एक session में, you go and you tell that I am a person who has exams every month and I feel very panicky and stressful before the exams. So when we start talking to you, we formulate and we start understanding you ki why is that stress occurring before exams, what are the experiences you had, what are your thoughts regarding the exam, what is your emotional response regarding that exam, and what is your behavior during the exam. Once we make an analysis of that, then we'll try to guide you based on the requirement and the severity of the condition. See, not every time you go to a psychiatrist we'll be giving you pills or tablets, because most of the people have this myth.
Stigma also there.
The myth that psychiatrist के पास गए तो पक्का दवा लिखेंगे.
They will like
yes, they will give you tablets and those tablets will make you sleep, but they're very addictive.
And obese, addicted and all
yes,
this
so बहुत पूरे side effects है. दारू पीने से डरते नहीं, लेकिन दारू के लिए दवा दिए तो डरते हैं.
बड़ा side effect हो जाएगा.
Right. तो it's like they have this myth ki every time you go to a psychiatrist they'll give you medicines which are sedating and addictive and things. So not all conditions require psychiatric medication. Some things can happen with counseling or psychotherapy also. We have something called CBT, cognitive behavioral therapy, where we discuss about the thoughts, feelings and the behaviors of a person, and we try to correct the maladaptive or cognitive distortions की negative thinking or faulty thinking patterns जो है ना, तो we try to correct them in that approach. Okay. So coming to your question, do I need a psychiatrist every time I face exam? Maybe not, because your psychiatrist or your psychologist will help you out about your self-help strategies whenever you face an exam.
Okay, like he may tell us like what.
Yes, acutely you might be having few sessions of therapy or medication if necessary to come out of that acute condition which you're really stressed out, and then they'll also guide you on how to manage your stress with relaxation techniques, breathing techniques. There are many other psychotherapeutic techniques which will help you out to manage your stress. Because stress is an inevitable part of life. It's not like तुम्हारा मेडिकल एजुकेशन करियर में ही स्ट्रेस रहेगा.
हर जगह स्ट्रेस.
हाँ, जॉब में रहेगा, शादी में रहेगा, घर पे रहेगा, ऑफिस पे रहेगा, किधर भी रहेगा. Even when you're driving, you'll be stressful. So there are certain techniques in psychology and psychiatry where you can do self-help with techniques and manage small bouts of stress.
But it depends on person to person.
Again, depends on person to person, and अगर stress का severity के भी it depends. If it is too severe stress, sometimes self-help might not work.
Point.
It's just like a band-aid. Self-help is like छोटा गाँव है तो band-aid से चलाएगा, अगर बड़ा गाँव है तो hospital आना पड़ेगा ना.
You need liver transplant. You was like nothing will work.
Yes, that's a very big situation. Yeah, but if you really need help, you have to come to the psychiatrist. If you feel that can be managed with self-help, like हमको तो first aid सिखाते हैं सब लोग. अगर घाव मिला तो wash it with water and put a bandage. That is self-help which we try to give you during the session. But अगर घाव बहुत ज़्यादा है, bandage से रुक रहा नहीं, तो you have to come. Similar way. If the stress is small, self-help works. If it is a bit more and it is not being managed by self-help, you have to visit your psychiatrist.
Okay, एक और चीज़ है जिससे लगता है कि शायद mental health affect कर सकते हैं, that is the money. So the generalized thing, I think everyone wants quick success.
Right.
And while like I think you are 12th pass, your friend may be BSc, maybe engineering, and they may start earning after I think 3 to 4 years. And you are in this profession, I think 5 साल तक आपने कुछ भी नहीं लिया. Even you are paying that fee also.
Right.
So in that 5 duration also you are thinking like भाई क्या कर रहा हूँ. You clear need, you know that you clear need, but ये feeling आ जाती है कि यार still I am dependent on my parents.
Right.
और इन अदर कोर्सेज देयर वाज लाइक वी नीड टू अर्न मनी, वी नीड टू. एंड अभी सोशल मीडिया का टाइम है, आपने किसी अच्छे इन्फ्लुएंसर को फॉलो कर लिया, उन्होंने एक थार ली हुई है, उनके पास iPhone 14 Pro Max है, उनको फॉलो कर लिया, फिर आप ये सोच रहे हो कि यार आप क्यों नहीं कर पा रहे हो.
Right.
वो मेरे से एज में छोटा है, मैं 3rd ईयर में हूँ, वो इवन 2nd ईयर में, वो लाइफ में इतना अफोर्ड रहा है, वो भी तो MBBS कर रहा है. ऐसा नहीं है वो भी तो MBBS कर रहा है, बट उसके साथ में इतना कुछ कर रहा है और मैं कुछ नहीं कर पा रहा हूँ. तो एक सेल्फ डाउट वाली चीज़ आ जाती है. और जो डिज़ायर है कि इजी अर्न मनी का, वो कई बार थोड़े से रॉन्ग रास्तों में फंसा देता है. आई थिंक कई बार आपको लगता है कि यार एक क्विक मनी चाहिए. सो पहला थोड़ा पता नहीं कि सोशल मीडिया के थ्रू, एड्स रन के थ्रू एक दिमाग में आता है ट्रेडिंग, कि उनके एड्स रन ऐसे होते हैं, यू पुट 10,000 यू गेट 25,000.
राइट.
तो इस चीज़ को कैसे मैनेज करें कि आपने इजी मनी के चक्कर में अगर आप कहीं फंस गए हो, तो डेट कैन ऑल्सो इफेक्ट योर मेंटल हेल्थ. आई थिंक सो.
Definitely, money can affect your mental health, because it is not an exaggeration when I say that like money can buy you happiness, but not at all times. So it was an old notion that money can't buy you happiness.
Come
but,
to Dubai.
Huh?
Come to Dubai.
But yeah, so money can affect your mental health, especially if you are the one who have a lot of debts. और some पैसा चुकाना है तो money can affect your mental health. Money can affect your mental health. If you're having a lot of money, it will be positive mental health only. If you have to give money to somebody, it will affect your mental health in a very negative way. Coming to the point of quick money, which you told, that we often get to compare ourselves to other people of other professions. As you told, you after 12th standard, you get into MBBS. Most of them get in the first attempt only, but there are some people who take a long term or they prep again to get into a better college or something like that. So वैसे कुछ साल you'll lose and then you come to MBBS. So by that time you come out of MBBS or you're in your internship, you'll have your contemporaries who were in school age. Some people will be like businessmen who are running in their own family business. They'll be having their own cars, they'll be having their own homes. They'll be married with kids also sometimes. Or some people who are into the other streams are buying phones, buying cars or going on the vacations.
Like
और
वो चीजें थोड़ी सी ज्यादा हिट करती
it gives you that FOMO. It gives you that FOMO कि भाई मैं क्या कर रहा हूँ जिंदगी में. हाँ मैं तो मेरा बीड़ी चौरासिया और डिंगरा के साथ
शायद आपको कार चाहिए भी नहीं, बट स्टिल उसके पास है मैं क्या कर.
That's called FOMO ना. Even though you don't want it, you feel like अरे यार काश मैं भी ये करता होता. If at all I took in that profession, so that will give you that desire कि चल मैं भी कुछ करूँगा. I also need money. And another factor is, as you told, in this age group only we start to get more independent. We want to be independent and autonomous.
That like we need that self-independent, self-earn kind of tag in the 20s.
Need to take our own decisions. कि अब मम्मी डैडी के पास पैसे मांग के we can't say I want to go on a Goa trip. अगर वो पैसा हमारा है तो we can happily confidently say मम्मा मेरा पैसा है, I'm planning a Goa trip. But you can't want to go to a Goa trip and say I need to ask money from my dad. So that need to be independent and make at least satisfy your own small desires with your own money, that urge is more prevalent these days. I think it was there since long, but it is more in these days. And with the new technologies and, as you told, the ads and the apps, not only stocking. Back then it was betting. Now it is stock market. So in this gamble, people are putting money. They're getting it quickly. See, I have no qualms against financial literacy. I think every doctor should have a subject like, along with the 19, there should be financial literacy of doctors also. Because it is very important to know about the finances and how to manage your stuff. Because in these days, nobody can run on one investment, one income only. People need to have parallel incomes, multiple sources of incomes, because our profession is ever changing. The demands are changing. With new AI technologies, you never know. The healthcare system might be partly replaced by the health AI system also. So you need to have other sources of income. Having said that, many people are getting into the loop of trading or gambling or 365 rummy, bet rummy, whatever those names.
Stuff.
Yeah, IPL के time पे and all that कि आप put 1,000 rupees, you're getting 2,000 or 5,000. Put 10,000, you're getting 20,000.
And start with simple. You can start with just 50 rupees. I think that cricket games you can start with just 50 or 100 rupees.
Exactly. So it starts with that. Initially you get gains, and then suddenly there's a sudden drop. And now that is a critical point where the people will get divided. Where there are people who are like, अरे भाई ये हमारे साथ तो नहीं होगा. I'll just repay whatever I have lost and I'll keep चुपचाप. I'll do hard work and do. And there are other type of people who are like restricting. चलो, I'll take loan on this amount and then I'll put more money and see मुझे आएगा. I'll learn, I'll do. There are people who gain success like that, who are risk takers, and who are people who lose more money and they end up into mental health issues. तो फंडा ये है कि जो मनी इजीली आएगा इजीली खर्च हो जाएगा.
Money comes quick, goes quick kind.
Exactly. The hard earned money, it will be hard for you to spend also, because you'll be a bit more mindful about what you spend. So as much it is nothing wrong to do trading and all that, it's altogether a different source of income. I respect that system, and it is a very good thing. I think people should know. People should be mindful about what they do, because it is a very vulnerable age. We are very impulsive these days. Everything we want instantly. In a snap of moment, we want everything. So in the same way, even the technology now is making many apps who are loaning you amounts so that you can put money into such thing apps.
Just need a PAN card.
Right.
Just need a right. Of 600, 650
so,
civil, they can rent.
In this whole gamble, I think the customer is becoming a joker. I'm not blaming the companies, because after all,
their business.
Yeah, it's a business. It's a strategy. It's the responsibility of the individual only. Just like the disclaimer रहता है ना हमेशा एक फॉर्म पे इंश्योरेंस कंपनी, तो you it is completely responsibility of the customer only to be more mindful. जागो ग्राहक जागो. As much as it's important to have your own finances, yes you will, but you have to understand the fact that though your course is long, the returns are high. You will get it.
Sometimes
you need to be patient in life.
आप आपका इतना टाइम वेस्ट कर रहे हो just for 1,000 rupees. Instead of that, अगर आपने टाइम को अपने MBBS में इन्वेस्ट किया होता, that will be much more good in the long term. Definitely, because your starting pay will be much more higher than the starting pay of your contemporaries in other branches. But now that we have many doctors, opportunities भी बढ़ रहे, so we have more scope. Just that we should not be disheartened. हमारा starting slow रहेगा, लेकिन तरक्की होगी. There is always light at the end of the tunnel. Just that the tunnel is very long. That's it. Because I think I made this podcast because बहुत सी चीज़ें मेरे साथ हुई, not मेरे साथ मैंने सुनी, Like in one of my friend college, a final year student, like one of my known friend, a final year girl tried to commit suicide just before exam.
Oh.
Final year exam. So like how toxic it is. Like not toxic, but like how difficult, or like sometimes student not able to face that.
Yeah, toxic. Like we are hearing a lot of suicides in medical colleges. Yeah, I mean, see, the importance of mental health has been like it has been raising very incrementally over the past few years, because with so many news of suicides in many medical students, many PG
Even
residents, physicians or established consultants are also committing suicides. So आप अगर देखो तो 2010 से 2019 तक 9 साल में almost there are 400 deaths of medical professionals, including 400 deaths approximately, to be precise 358 deaths, like medical students, residents and professionals included. So you can estimate how much is that is the tip of the iceberg who are committing suicide. अब समझो कितने लोगों को डिप्रेशन है, जो है submerged part of the iceberg. So I think mental health awareness is very important these days. Like people should know that mental health issues are there. One should accept that mental health issues are there and they should go out and seek help. There's nothing wrong in seeking help.
So I think after this podcast, अगर एक भी students ये face कर पाता है, okay, I need help, I need to go to psychiatrist, this podcast will be worth.
Definitely, and I'm pretty sure people will get to know that it is okay to seek help. It is not a sign of weakness. People might laugh at you, people might mock on you, but at the end it is your health. You are responsible and you should take care of it. Just because people might talk about you, might laugh at you, you can't suffer in silence. It is high time people come out and talk about it and seek help.
So any last message to all your lovely students regarding anything?
Well, I give a lot of messages to all my lovely students, but and all the other viewers who are watching it. It has been a wonderful podcast with Dalpat, and thank you for calling me in this podcast about mental health. And I'm really happy to speak about mental health, because I think in this changing times, in this fast-paced world, one needs to, as much as we take care of our physical body, it is very important to take care of our mental health. And what better way to take care of mental health by increasing your knowledge or awareness about mental health and knowing that people are there out there to listen to you and give out help. And let us also break myths about mental health or psychiatry or psychology, that people always prescribe medicines, people always put off a diagnosis where if you just enter the OPD you're given a label or a diagnosis. No, even a normal person with small stress can walk into the OPD or a psychiatrist and just have a casual talk, just like you're putting your things in your head, decluttering your head and just putting it out.
Yes.
So even a normal person can come to the OPD and walk away with happiness, just to clear their mess out. That's it. So not all people whom we see are mentally ill. There's a fair share of normal people also who think they're mentally ill, but they'll be surprised to know that it is very normal. As I mentioned, being angry, being sad can be a very normal emotion also sometimes. But we tend to have this internal stigma कि हाँ मुझे कुछ problem है, मुझे कुछ depression है, मुझे anxiety है, which might be a normal thing in that scenario. So I request all the viewers to encourage and promote mental health awareness in whatsoever field you are. And if you feel you are suffering, or you might feel that somebody around you is suffering from mental health issues, please feel free to reach out for help. And thank you.
Okay, sir. Thanks a lot.